Okay, so Paro is a non-pharmacological intervention that is complementary to other types of therapy, such as music therapy, art therapy, doll therapy, and other activities or therapeutic programs. It's not meant to replace human contact. In fact, it can encourage more of a human contact. Often it's used with people living with dementia that are experiencing changing behaviors, especially as the disease progresses. So behaviors such as aggression, whether it be verbal, physical, agitation, restlessness, or other forms of changing behaviors. And it can help alleviate these behaviors. It is an expensive intervention and therapy. Just to purchase Paro, I think it's in the $5,000, and to maintain the animal, the robotic animal, also incurs fees throughout the years. However, there might be establishments that do have a budget that can be used for that. However, I do see it as a complementary therapy. And how it can be used, it can be used in individual interventions. As we all know, as the disease progresses, like people living with Alzheimer's disease or other forms of dementia, as the disease progresses, they often will not be able to initiate activities on their own. Often their socialization interactions will decrease. And so Paro can be used as a means to engage them in activity, to stimulate them. For example, in a nursing home or in a residence, a person that may need to be given a foot treatment or needs to be fed, loss of appetite, maybe using Paro can have an immediate effect on calming the person down and allowing the intervention to happen as well. I haven't, done research on it, or we haven't had any studies here at the Society. We do not have Paro at the Alzheimer's Society of Montreal. We do have other alternative therapies, but I can see how it can be used in certain individualized interventions, and it can complement other therapies that might be used.
So do you think it's worth the money?
Well, for the Alzheimer's Society of Montreal, we're a non-profit organization, and therefore it would be, a huge expense. And I think, there are other. It would be a huge expense. I'm saying so. Obviously, it would not be maybe a therapy that we'd be using at this moment.
But considering the benefits, is it worth $6,000 plus expenses?
It's all relative to the budget of the organization. If an organization has a budget that allows them to spend that money, it can be an interesting alternative therapy, definitely.
Is there a downside? Is there a downside to Paro Robot?
I can't fully, attest to it having a downside, but as long as it's not used to replace human contact. But I do see, which I didn't mention earlier, the benefit of, the sense of, for the person to, for their need of stimulation, sense of security, sense of warmth. It can fulfill that need. I've seen people interact with Paro, but the negative effects, I'm saying, would be if a person reacts negatively to Paro, definitely we would not continue the intervention. So it's really based on individual needs, the person. So it's hard to say in general that it is not, there's a downside. Any therapy, alternative therapy, when you're looking at music, art, activities, physical, any form of stimulation will all depend on the individual themselves, and what works one day might not work the next day, and so forth. So it's very, I cannot say per se, exactly what are the negative, effects.
Sometimes the demented patients are not aware that it's not a robot or it's not real, it's not a real seal, do you think does it make a difference?
In my experiences, as I oversee activity centers on Saturday, and we have an in-home stimulation program where we work with individuals in their homes that are living with dementia, it's the present moment that counts. So in that present moment and during their interaction, they will see comfort. They might not distinguish, between, for them, it's something that brings them happiness, warmth. It depends at where they're at in their disease. So someone in the early stages of Alzheimer's disease might, be informed of Paro, but I'm saying I don't see, maybe for them, it might not be effective as an intervention because there's not that need. It's not fulfilling a need they have because they're still having very much a lot of human contact. They're still out in society, socializing and engaging in their everyday activities. So it really, and the long-lasting effects of Paro, I cannot speak for that, but I could say that in the immediate moment, and maybe what you've also seen, attested yourself and seen, is that the visible benefits in the immediate moment are there. Now, how long do they last? That's hard to say, but it's beneficial to them in that moment. We don't live in the present or in the past. We live in the moment where the person's at as well. I don't know if that answers.
Yes, it does. So you don't think that Paro diminishes human contact or interaction?
I think it could complement, it could flourish the interaction, it could encourage a better interaction. At times a person who's more withdrawn might verbally not speak, might be more afraid. Maybe it can be an introduction, and to help establish that human contact. I don't think so. It's Paro, the seal, the robotic seal, is not used, pass it on to the person and here you go and they leave. There's a time where it's used. It's not used all day. There's, probably, and when it's used individually for individual intervention, I'm, assuming they have a plan, like of when it's used and at moments that it can be helpful to the person.
Is there another way it could help people? Do it help integrate them, or?
There's human contact is important. If I can speak as a person, a professional working with people living with dementia and their caregivers, is getting to know the person is the most important thing. The person comes before the disease, and getting to know that person, getting to know their history, their past, the things they're still able to do, what they enjoy doing. It's a trial and error. That's the basis before you can even introduce any forms of therapy or alternative therapies as well. So there's not only Paro. I think that's it's just like doll therapy. There's doll therapy, which is sometimes not always viewed in a positive way, but very effective for the individual using the doll in intervention as well.
Do you think it could diminish the medication, or?
I do believe alternative therapies, if they're used appropriately in the person's treatment plan, at times, can alleviate the behaviors that a person is experiencing. Often, behaviors such as either verbal, physical, aggressive behaviors, as they refer to them as, or agitation, restlessness, at times is often caused by a person's environment, loud noises, too many people, by lack of stimulation, because, and not having any contact, no socialization, because of a progression of the disease. And so I think a balance between, having the right medication and also fulfilling the need for the person to be stimulated. They have a right, and will then help, that maybe antipsychotic medications of that nature are not needed as much as well. And there are, situations where, unfortunately, medication, might be needed. But I think a balance between, non-pharmacological interventions can be beneficial to the individual as well.
Good, that's about it. Do you have anything else to add on the subject?
If you need more information, like for caregivers about Alzheimer's disease or other forms of dementia, resources, the Alzheimer's Society, we're a nonprofit organization. We service the island of Montreal. We offer programs both in English and in French. We're bilingual. We offer counseling support services to caregivers and people living with dementia, as well as respite and stimulation programs, art therapy, as well as monthly activities for people living with dementia and their caregivers. And lastly, educational trainings and conferences. And you can contact us, and there always will be a counselor available to respond to any of your questions or your needs as well.